If you've ever been constipated that you're having to use fingers to help clear the stool, you're not alone, because a lot of people don't know that this simple thing can lead to long-term damage. I am Dr. Yoganand Reddy. I'm a senior medical gastroenterologist, and today in this video I will explain to you why putting finger in the back passage to manually remove the stool can do more harm. Digital evacuation, which means using your finger to remove the stool from the rectum, either because it's not coming out easily or you feel that there is still something left behind and you want to clear. Even in the hospitals, we sometimes have to do for people who get admitted because they have severely impacted stool in the rectum, which can happen due to the medicines they might be taking, or they may be suffering already from severe constipation for a long time. The stool is got impacted and it's no way it's coming out easily, or they may have had some kind of a surgery. They may be bedridden for some time because they have had some spinal injury or something. So there are a variety of reasons why under medical supervision we do that. But when people start to do this kind of a thing at home, this can create a serious cycle of dependency and long-term problems. So just to give you one example, I've got this young patient who is a office-going person, struggled with constipation for a long time, been taking various medicines, Churan, Isabgol, this, that, and the other, and variety of laxatives. Every time he goes, sits in the toilet, half an hour, 40 minutes, and it feels like nothing is coming out easily, or he feels that there is still something that is left behind. So eventually he starts to use the finger to help remove the stool, thinking that this is okay, it's not going to cause any harm. But later on, he started to notice small amounts of blood in the motion, some pain whenever he passing motion. Sometimes the pain is so intense in the bottom, in that anorectal area, and always a sensation that there is something left behind, it's not emptied properly, and therefore having to use the finger. So finally, when he came to see us, he wasn't very open about it. We had to specifically ask him, has he been using finger to help pass motions? So when we did this examination of his colon, colonoscopy, which is the endoscopy examination of the colon, the large intestine, we found this, which I'm going to demonstrate to you shortly. So this is a colonoscopy, which is the endoscopy examination. We have inserted the small, thin, flexible tube through the back passage into the rectum. So we are seeing this area that doesn't look quite normal. As you can see, we have put some different colored light we are observing. So as you can see, this area looks very different from this. So normally we should see like this nice blood vessel pattern, nice and smooth, whereas this is all a little bit rough and ragged, and so that whole area looks very different from this part. So this is the normal part, and this is all. So we are trying to establish a little bit more how far it goes in. So this you can already see that there is a lot of ulceration that is happening. So normal, healthy looking rectum, we should see this kind of nice, beautiful blood vessels that supply the gut. So this is obviously not normal, but it looks nasty, but it is not something serious like a cancer. So there is a big ulcer here, and this is not something that has suddenly come. This has taken months for it to appear because of chronic constipation, because of repetitive trauma, repetitive injury. So this whole area is clearly very abnormal in a young person. So we are carefully examining, taking our time to analyze, and having a good look with the high definition endoscope. So you can see all this is all kind of ulcerated. So there is a long-standing ulcer as soon as we have inserted the scope in the rectum. Rectum is the last part, so we're using a different narrowband imaging. It's a different color so that we can see the difference between this area and this area. So this is a high quality endoscopy to analyze and see what is happening so that we can give the right treatment to this patient. So this is what we call a solitary rectal ulcer. So single large ulcer in the rectum. This can happen from a repetitive injury created by himself, so by chronic straining, putting finger up the back passage repeatedly, that can damage the wall of the rectum. So this is a problem I see very often, and the worst part is it's actually preventable. So why we do not advise people to use finger to help pass motion is because rectum is very delicate part of the gut. Putting repeatedly finger finger can cause sometimes micro tears, so like scratches inside. It can bring on bleeding, so there is also possibility of introducing infections. It can start to result in complications, what we see from repetitive straining, what we call as fissure, which is like a cut in the anal area, which can be extremely painful, or piles, what we in medical terms call as haemorrhoids, which are swollen veins in that anal area. Or even we sometimes see the rectum coming out because of the repetitive strain. So all these things can cause variety of problems in the long term, including fresh bleeding. Those people who are getting repetitive straining, chronic constipation, repetitive manual evacuation that is required with the finger, they start to develop, it's a vicious cycle, so it keeps on happening repeatedly. So it feels like as if their intestine is coming out. Sometimes people complain that part of their rectum is bulging out. So worst part is many people do not notice the damage, like just how I've shown you this rectal ulcer, unless the bleeding becomes repetitive or the pain is persistent. That's when they come and see a medical gastroenterologist like myself. Until then, they keep delaying it. So why does putting finger in the back passage to help pass motion causes problems? That's because your rectum stops to function normally. What happens is you lose that natural urge to pass the stool because the nerves start to get desensitized. So they kind of lose that natural sensation. Pelvic floor muscle dysfunction. So you can start developing some incoordination of the muscles. So because the rectum has to squeeze, the anal opening sphincter has to relax, the abdominal pressure has to rise. So all this is a very coordination mechanism that all gets disturbed. This is something we can measure by a test called anorectal manometry, where we can demonstrate that there is a pelvic floor dysfunction, pelvic floor dysenergia. So if this is a coordination issue, we can fix this by simple pelvic floor exercises, by simple techniques that we can teach and enable patients to do without depending on medicine. So by repeatedly relying on manual removal with your finger or laxatives and various medicines, you will of course end up with dependency and chronic constipation. Younger people, of course, it is psychologically distressing, it's embarrassing. I can understand they don't want to talk about it to their partner, to anybody in their family, so they feel somewhat anxious. Sometimes they feel ashamed to talk about this. But this over a period of time will start turning into chronic anorectal diseases. Sometimes you end up going and getting operated. I see patients having repeated surgeries for fissures, piles, without actually addressing the root cause, which is the anorectal dysfunction. So what should they do instead? The good news is you can break this cycle safely by increasing the dietary fiber gradually, pushing the water intake, establishing a toilet routine. So try going to pass the motion when you get the urge to go. Do not repeatedly ignore the urge to pass motion. Of course, temporarily there is no harm in using some stool softening medicines or some laxatives under the guidance of your gastroenterologist. If you have pelvic floor dysfunction, that is proved by the simple test called anorectal manometry, then simple things like biofeedback therapy, which is like, imagine like physiotherapy for an injury in your shoulder or back. Similarly, we can retrain the pelvic floor muscles without the need to take long-term medicine. So putting finger and digitally evacuating stool might seem like a quick fix, but you will start depending on it, and this can cause long-term problems. If you're struggling with constipation, if you're having repeatedly to use finger, don't be embarrassed. Speak to your gastroenterologist, because we see this every day. So there is nothing that you need to be ashamed. There's nothing that you need to be embarrassed, because this is a problem that if we can identify early, it can be fixed very easily. Please comment below if you need any more information on this and also any other digestive health videos. And please forward it to somebody whom you might know will benefit from this video. Thank you.